Are contact lenses or having LASIK eye surgery more dangerous for your eyes? Recently, I've been seeing a lot of videos with the claim saying, yeah, contact lenses are more dangerous, so you might as well look into having LASIK. And a few months back, I put out this poll asking that same question, and about 2/3 of you said, yeah, it looks like LASIK would be more dangerous. So I want to make a video going over that claim. Are contacts more dangerous? What are the numbers? What are the statistics? Let's focus in. Nearly 45 million people in the US wear contact lenses right now. And when surveyed, nearly 99% of you report having at least one bad, poor hygiene habit that can lead to a contact lens complication or infection or an eye problem. So nearly all of you likely have one of these poor habits that you probably should change. Improper cleaning, handling, so not washing your hands or not cleaning the contact lenses how they should be cleaned. Topping off the contact lens solution, not cleaning the case, not starting fresh. Another one is overwearing your contact lenses, whether it's made for 1 month, 2 week, 1 week, daily contact lens, you're wearing it longer than you should. And be honest with yourself, I know it's more than people say. And then the biggest risk factor is sleeping in contact lenses. No matter the brand of the contacts, whether they're approved for sleeping in them, if you sleep in your contacts, you are 3 to 5 times more likely to get an eye infection or an eye issue related to your contact lenses. In fact, they say 1 in 500 contact lens wearers every year will have a serious eye infection or condition from contact lens wearing that can lead to decreased vision or blindness. So what are some of these complications? This can range from mild conditions or irritations from contacts to definitely more serious ones, yeah, that can lead to blindness. They can cause corneal abrasions, micro scratches that leave little entryways into the corneal tissue for bacteria or infections. Something called giant papillary conjunctivitis, or GPC. This is kind of a mechanical allergy from your eyelid rubbing on the contact lens or the debris that's on the contact lens, and causes an allergic reaction of the inner layer of your eyelid, causing these kind of bigger bumps on the eyelid. Can be very irritating, especially when you take the contacts out. You can actually feel those bumps rubbing on the eyeball and can be tricky to get rid of. In fact, I did a full video on this that I'll put in the description if you want to check it out. Another fairly common one is dry eyes. Wearing contact lenses can disrupt the tear film, cause more irritation, inflammation, can cause more salty tears, and kind of get you in the cycle of having dry eyes. Now, a few conditions that actually can lead to decreased vision or blindness. One is neovascularization. This is where new baby blood vessels will grow into the cornea, where the cornea has reduced oxygen because the contact lens is limiting the oxygen getting to it. So it's starving of oxygen, so it tells the eye, hey, I need new blood vessels in here to bring in oxygen so I can survive. And those baby blood vessels will grow inside the cornea, and if it gets in front of the pupil, can actually reduce the vision, and those vessels don't go away. So it can cause a permanent reduction in vision. Another one is infectious keratitis, corneal ulcer, where you'll have an ulceration of the corneal tissue, and if it gets deep enough, can cause scarring. And if it's right over the pupil, that scarring will stay there and cause a reduction in vision. And then another scary one, and usually this is where all the horror stories of contact lens wearers come from, is acanthamoeba. If you are wearing your contacts in water, the hot tub, the lake, and you sleep in your contact lens, there's an infection with acanthamoeba parasite that can actually get into the corneal tissue, and it is very difficult to treat. It happens really fast and definitely can lead to blindness. Just a horrible, scary condition. Luckily very rare, but can be very, very bad. With all these problems from contact lens wear, they found that 5% of those issues can lead to a decreased vision, blindness, 20/70 or worse. On top of that, they studied, hey, what's the accumulative effect? If you wear contact lenses for 30 years, they found that the risk of getting an eye problem from contact lenses jumps to 1 in 100. Now, having said all this, there are definitely risks to wearing contact lenses, and I've seen pretty much all of these conditions that can come from contact lenses. In fact, some of these, like corneal ulcers or infections, can be fairly common. To a report saying that nearly 1 million eye doctor visits in the US is because of a corneal infection caused by contact lens wear. But having said all this, I will say that these conditions are treatable and preventable. So with all the scare tactics of wearing contact lenses, a lot of it is treatable, especially if you're looking at your poor habits, you're not sleeping in your contact lenses, you're going to your eye exams and checking the health of your eye and making sure the contacts aren't causing problems, then likely you will be on the good side of those statistics. So now let's talk about LASIK statistics. Nearly 1 million people in America have LASIK eye surgery every year. And when you're talking about LASIK, there are two words that get thrown out: side effects and complications. Now, with side effects, there are definitely some temporary side effects that a lot of people experience. This can include dry eyes. Upwards of 30%, some reports show 50% of people experience increased dry eyes within the first 3 months of having LASIK while the eyes are healing up. There can be increased glare and halos right after LASIK, again up to 3 months while the eyes are healing up. Now when we're talking about complications, these are issues that arise from the surgery itself that can cause vision reduction, maybe blindness if it's really bad. Now the reported complications with LASIK is less than 1%, which is actually really good for any type of surgery or procedure. This can include flap complications if the flap doesn't heal correctly onto the cornea. Sometimes you can get epithelial ingrowth where cells from the outside cornea grow on the inner layer of the flap. You can get inflammation underneath the flap that can cause problems. You can get corneal haze after the surgery that can actually cause visual issues. Or it's possible to get an infection from the surgery itself. Again, these are rare, less than 1%, but can be a complication. Now, what I want to bring to light, which I feel kind of gets swept under the rug of the long-term complications or the chronic conditions that some people develop after LASIK. Now, again, rare, the percentage is low on some of these, but I feel like not a lot of people talk about it, and so I want to talk about it. One is a chronic dry eye or a long-term dry eye condition where some people that get LASIK after the 3-month period, the healing period, they still continue to have dry eye issues. This percentage has been climbing with more and more recent studies. It's kind of started from, hey, only 0.8% of the people that have LASIK have dry eye conditions to 20% of the people will have a more long-term chronic dry eye after having LASIK. This is years and years after they just kind of battle a dry eye condition. And the severity of dry eye can range from mild to pretty severe. Another condition that I think is gaining a little bit more speed and more awareness is neuropathic pain. When you have LASIK and you create a flap, it cuts the nerves of the cornea. Now those nerves do regrow back over the period of 6 months after having LASIK. But in some people, the nerves may not regrow back or they don't grow back correctly. And so some people are left with this chronic nerve pain in their cornea, and it can be debilitating. They can constantly be seeking dry eye treatments or any type of treatments to help those nerves regrow back or just reduce the pain of their eyes. And more recent reports are showing that 1 in 900 people can experience this neuropathic pain. Again, severity can range from person to person, either mild to severe. Another possibility after having LASIK is a change in corneal structure. When you have LASIK, it does cause your cornea to be thinner, and if it is a little too thin, it can cause bulges and curves in areas that shouldn't be. This can be causing keratoconus or corneal ectasia, where it can actually affect the vision, the visual outcome, to the point where maybe glasses or normal soft contact lenses can't correct the vision and they might need specialty contact lenses to get adequate vision. So what would be my answer? Contact lenses or LASIK more dangerous for the eyes? Statistics are against contact lenses, but I hate the question. I hate the premise of the question because it really depends on the person. Depends on their personal eye condition. How are they handling the contact lenses? What is their prescription? Are they getting infections already? Then yeah, maybe that person should look into getting LASIK or at least not wearing contact lenses. But it really depends on the person because I just want to educate people of the possible chronic conditions that people could get. Rare, but could get. I just want people to know about those. I hope that helped.